There are 4 types of malaria. The first, mosquito-borne malaria. These outbreaks are usually small and very isolated, but on occasion investigations are usually pursued if there seems to be an unusually high number of cases in one area. Most cases seem to arise in the southern states. The second kind, known as airport malaria, is also very rare, but it can happen. In these cases, a mosquito is physically transported from a country that is infected to an airport of another country that has not been infected. The mosquito then goes on to infect the people in this new country who don't have immunity. It can be an interesting situation because sometimes a strain can infect a person who has ironically never been abroad. The third type is known as congenital malaria. This kind of malaria can be transmitted from a pregnant mother to their child either during gestation or during delivery. It is important for physicians nowadays to take a complete and accurate history of the mother, as well as her family and her friends who have recently traveled to an area where infections are prevalent. It is also very important to keep an eye on neonates and moms who develop fever after delivery. The fourth type is known as transfusion-transmitted malaria. This kind of malaria is a severe complication in patients who receive blood donations. Usually, there's only 1 case every 2 years in the United States, but there are currently no screening procedures at blood banks to test for malaria. Quite a scary thought.
There are many different symptoms of malaria, and usually the incubation period is 7 to 30 days. Uncomplicated malaria is very rare, however, it usually lasts 6 to 10 hours, and there are 3 stages. The cold stage, which includes cold sensations and shivering. The hot stage, which includes fever, headaches, vomiting, and in young children, seizures. Sweating stage is the final stage and includes sweats, return to normal temperature, and tiredness. In countries where cases of malaria are infrequent, this form of malaria is often misdiagnosed as the common cold. However, in countries where malaria is common, the infected often recognize that it is malaria and can treat and diagnose themselves. Severe malaria occurs when infections are complicated by serious organ failure or abnormalities in the patient's blood or metabolism. Severe malaria is a medical emergency and should be treated urgently and aggressively. Manifestations of severe malaria include febrile malaria with abnormal behavior, impairment of consciousness, seizures, coma, or other neurological abnormalities. Severe anemia, acute respiratory distress syndrome, abnormalities in blood coagulation, low blood pressure, acute kidney failure, hypoglycemia, and many more.
In order to treat a patient that is infected with malaria, most drugs used in treatment are active against the parasite forms that are found in the blood. Treating a patient with malaria depends on what type of species the parasite is, the area where the infection was acquired, the drug resistance status, the clinical status of the patient, the age of the patient, any accompanying illness or condition of the patient, whether the patient is pregnant, and any drug or medication allergies the patient might obtain. Treatment is meant to decrease transmission of the infection to others by reducing the infectious reservoir and by preventing the emergence of spreading of resistance to anti-malarial medicines. Severe malaria should be treated with an injection, followed by oral medication once it is tolerable for the patient. A delay in diagnosis and treatment is a leading cause of death in patients that are infected with malaria in the United States. Because malaria is a potentially fatal disease, treatment should be initiated as soon as possible. A clinical diagnosis, which is confirmed by a laboratory test, is based on the patient's symptoms and physical findings at examination, whereas a microscopic diagnosis occurs when malaria parasites can be identified by examining under a microscope a drop of the patient's blood and observing the blood smear.
Organizations all over the globe are working closely together to monitor the infection and spread of malaria. In response to the malaria outbreak, the CDC has been nationally monitoring the disease, investigating local instances, controlling disease and travel, providing preventative and treatment education to clinicians, providing a drug called artesunate in extreme malaria cases, educating blood collection centers, and collaborating with other organizations. They also regulate case management and give preventative methods such as insecticide nets, preventative care in pregnant women or infants, and indoor spraying for mosquitoes. The WHO has a document called the Global Technical Strategy for Malaria, which is used for intervention and surveillance. The WHO also gives recommendations and preventative methods such as sleeping under nets, using protective clothing, and insecticide repellent, a preventative medication called chemoprophylaxis for international travelers, and avoiding travel to certain areas, especially if you are at risk for infection. They also release international travel and health guides. There's also a coordinated initiative called Rollback Malaria, which is designed to take preventative and response measures against malaria and partners together the WHO, UNICEF, UNDP, and the World Bank.